Good morning, everyone. It gives me great pleasure to welcome Dr. Jyotsna Puri to Development Monitoring Evaluation Office. She is the head of Independent Evaluation Unit in the Green Climate Fund, headquartered in Seoul, in South Korea. And she's going to make a presentation on innovations in impact and measurements. What are we learning? Dr. Puri has a PhD and MSc in resource economics. I understand it's from Columbia University.
No, so I teach at Columbia, but I got my PhD from Maryland.
She's also adjunct associate professor at the School of International and Public Affairs in Columbia University. Before she worked for Green Climate Fund, she was deputy executive director and head of evaluation at International Initiative of Impact Evaluation. That's the 3I, which is headquartered in Delhi, with which we are hoping to have a partnership soon. Dr. Puri has close to 24 years of experience in policy research, development evaluation, with several organizations including World Bank, UN, Columbia University. Her research interests include, her dissertation was on biases that creep into policy evaluation, and specifically in environmental policy. Our research also includes measuring the poverty impacts of rural road buildings, application of economic theory and modeling with disaggregated data and measuring heterogeneous impact. She has conducted a number of evaluations for UNDP, UNICEF, Jeff McHacker Foundation, and the evaluations have been focused on examining evidence-based climate change and environmental policy, advocacy for policy and behavior change, community-based engagements for improving vaccine coverage, methodology for rigorously evaluating effectiveness of humanitarian action. She also has a lot of interest in policy research in Asia and Latin America, especially on policies in the areas of environment, agriculture, health, and climate change. I can go on for another 1 hour, but I think I'll just stop here. And on behalf of DMEO, again we welcome you, and the floor is yours.
Thank you again, everyone, for being here, and please call me Jo. So I'm going to talk about innovations and impact and measurement, and what are we learning. And just to set the, just to set up the framework. What I am hoping is actually that this will be far more interactive than you would probably think or imagine. So with your permission, Sekhar, feel free to interrupt, ask me for clarifications. And what I'd like to do is to hopefully try and have a discussion at the end about how some of this could be applied to the work that you're doing. But what I'm basically going to focus on is some of the global evidence and global innovations that we are seeing in methods as well as techniques in evaluations that are also helping us explode myths. Right? So feel free, with your permission again, Chair, to interrupt if you need clarifications, but for a bigger discussion and how this might apply to some of your work, I'm very happy to have as engaged a discussion as you'd like towards the end. So thank you again. So, the outline of the talk. So I'm going to talk about 4 things. The first one is deep fakes. Yeah? And you've probably heard about fake news, but deep fakes are the new frontier now. And it's really about thinking about how evaluation can help to explode myths, yeah? And especially erode deep fakes. Second, yes, we can. Technology helps, right? So to think about what are some of the technology and technological developments that we are seeing that can help us to do some of this work. Third, the last mile and behavior matters. And I know some of you, well, I'm going to talk about behavioral science. So Kahneman and Tversky and the work that they're doing, and Richard Thaler, and how this is applying to some of the work that we're doing and thinking about, and hopefully how this might apply to some of the work that you're doing. And last but not least, inclusion. So how is evaluation practice changing? So to talk very briefly about some of the work that we're doing at GCF, but I'm not going to talk too much about it unless you express your interest. So a large part of this is also about responding to your demand. Yeah? So please ask me questions and then I'll be able to talk to you about whatever you want me to. So the first one is innovations in evidence can help beat myths. Right? So deep fakes, innovations in evidence can help explode them. So the first myth is nothing works in crisis. And this comes from my experience in humanitarian situations, and like Sekhar said, I've looked at a lot of the evidence about and worked with humanitarian agencies, including UNICEF, WFP, so the World Food Program. But of course, there are lots of crisis situations in India as well as in the larger subcontinent. And the unfortunate thing is that basically it's a very reactive mode that most agencies and organizations and governments take, right? So you basically, okay, well, let's just band-aid what we've got rather than think about what has been done and what's evolving or emanating from the evidence. So one of the key questions that has been asked in this space is, okay, when a humanitarian crisis, whether it's anthropogenic conflict, so whether it's man-made conflict, or it's a climate change-related disaster occurs, what should you do? Should you employ cash? So just give us cash transfers? Should you do food transfers? Or should you do in-kind transfers? And these are choices that governments and governments and agencies have to make. What should you do first? WFP, for example, has thought a lot about this and didn't know what to do. So there's a wonderful systematic review that was done by Shannon Ducey and Hannah Trackness at the Johns Hopkins School, which then looked at evidence from 500 studies. Not all of them experimental studies, so experimental meaning randomized control trials, but 100 of those were, and then the rest of them were qualitative and process studies that then synthesized a lot of the learning that was coming from these so that they could help decision makers understand as to what works. Right. And again, the choices have big consequences with how you set up structures on the ground. If you're going to do in-kind transfers or food transfers, so I was in DRC, the Democratic Republic of Congo, and there the big questions are, well, how will we transfer huge amounts of things for in-kind, right, if you're taking utensils or clothes or medicine, versus how will we transfer cash? Very different questions, very different supply chain consequences as well. And what the systematic review basically showed is that cash works in crisis, right? So despite a lot of the detractors coming forward and saying that, look, if you set up cash, and especially when markets are destroyed, it's not going to help because there are no markets where you spend money. The point is that overall, if you wanted to do something to understand as to what works or not, and if you hadn't looked at the evidence, the one thing that you can take away from this is, thank you so much for that. The one point that you can take away from this is that cash does work, even if not in the short run. In the long run, it does help to create enterprise, and it helps to generate businesses, small businesses that then help to sustain this growth over time. The multiplier effect of cash far outstrips the multiplier effect of in-kind transfers and food transfers. So it's for every $1 that you spend with cash, you generate $3 as a multiplier effect, right? So one is that. The second is that with in-kind transfers or food transfers, although your overall caloric intake might change and increase compared to cash, but the quality of the diversity in your food intake is far better with cash rather than with food transfers. So nutritionally, you're better off with cash than with food transfers, right? So this was the first myth that this systematic review helped explode. But the big innovation here is systematic review and doing meta-analysis. And thinking about how meta-analysis and systematic reviews can help us to think about evidence. Right? So that's basically what I want you to take away, systematic reviews. The second thing, again, is the second myth is that poverty alleviation, there's really not much solution. You can try most things, and, well, we don't know what works. But, and again, you all know Abhijit Banerjee, Esther Duflo, so they did a wonderful graduation program that has been applied to 6 sites, right? And they collected evidence that essentially created a package that contained not just training, but also contained subsidies, also contained training for enterprise development, subsidies given, as well as food-related transfers that were made to families. And so it was a package of 6 things put together, and they basically tested this. And this package is called, so it's sort of the graduation approach. But they tested it in 6 countries along different dimensions of poverty. And you all are aware of the multidimensionality of poverty, and you know how you can look at consumption and food security and look at assets. The nice thing is that essentially the study became a meta-review, right? And so you could create what is here as forest plot. And each one of the dots is essentially your effect size, and the size of the line is your standard error. So how confident are you with your effect size estimate, right? And it helps you to pool all of the different evidence coming from each one of the different sites. Then helps you understand, well, okay, we might have different experiences across all of our 6 sites and 6 countries, but can we pool all of that data and then understand what's happening on the ground, and can we take away messages about what works? So they looked at Ethiopia, Ghana, Honduras, India, Pakistan, and Peru. And irrespective of basically what sort of index you were looking at, they found consistent results in terms of consumption, food security, asset buildup, finance, a whole range of poverty-related indicators managed to improve when they used what's called a graduation approach across these 6 countries, right? So the interesting thing is building in this evidence right at the beginning and then planning for it as you go along, because this is what you want. Of course, you want these schemes to work, but you also want to know what's not working so that you can tweak your programs. But building in this evidence right from the beginning becomes really important. The third myth is we already know what we need to. Yeah.
Sorry, I'm sorry to interrupt.
Joe.
I wanted to ask about the first slide. How many, what kind of countries were chosen for this systematic review, and how long was this systematic review done for? And the second thing is, like you said, cash works.
Yeah.
And you did tell us that nutritionally also there were a lot of benefits, but I wanted to understand if, like the debate in India is about direct benefit transfer. It's a paternalistic approach where you force them to have food and blah blah blah. Whereas if you just give your cash, then since they're working in a very constrained manner, they might end up spending it on buying more medicines or something else, and maybe your girl child doesn't get to go to school.
Yeah.
I wanted to understand what systematic review found.
Really good question. So the systematic review that I was referring to is only in humanitarian situations, but it can have, so it can be prolonged crisis situations as well, right? So for example, Sudan, Somalia, they're just prolonged conflict, and so you can definitely be looking at those situations. It did not include India, but what it did do was to then examine questions. It did not look at intra-household allocations. So your question about, whether some sections of the household may be disadvantaged as a consequence and unintended consequences bang on. But they didn't look at intra-household allocations because there's unfortunately, actually in humanitarian situations, even though I've written differently as well, and I can help to refer to a paper where we set up systems for how you can do good, rigorous work in humanitarian situations. I have to say that the tradition or the culture of thinking about evidence and evidence production in humanitarian situations hasn't been very consistent or long. And it's actually when we talked about this systematic review and the evidence coming out from the meta-analysis that the WFP executive director cited the systematic review and said that as their goal, they were going to be putting 28% of their overall programming budget into cash. Yeah? So it's basically then using evidence to inform your decision making. So the idea is not to say that, of course, because this is an average effect, average treatment effect, it's not to say that that's your best solution every time. Yes. Right? And you have to gauge it for, well, what is your the key objective that you want to reach? And with DBTs in India, that's exactly the question that I would ask. What is your key objective here? Is it, ensuring family or household level nutrition and or well-being or livelihoods? And the answer is going to be very different if it's nutrition versus well-being. Just that small distinction is going to make you change your decision. So the idea is to use the evidence, but of course to inform it in a careful, cautious, but informed way. Okay, so the third myth was we already, and then your question about how long it took to do the systematic review. So once you, now with artificial intelligence and machine learning, we just finished an evidence gap map in 6 months, and I know that now the systematic review, because the gap map has been done in 6 months, we can do the systematic review in 2 months, right? So it's really quick because you've done the gap map. But now, and because you can use machine learning to search, now it's really cut down costs of doing systematic reviews from what used to be 2 years, now to very, very quick timelines. Yeah, so. Okay, we already know everything we need to. So that, how many of you know this logo from Cochrane? Okay, so Cochrane Collaboration is basically in the 1960s, the big doctor, a doctor who went to Ghana and realized that he had been prescribing something for malaria patients, even though the evidence had been there that the prescriptions that he was making for malaria patients was non-efficacious. And the evidence had been there for about 2 years, except he didn't know it. Right? So even in medicine, doctors had to deal with, at their time, that yes, you may be innovating, you may be doing efficacy experiments as well as effectiveness experiments, but you don't know what the evidence is. So you continue to work in the same way as if the evidence hadn't been there. So he started what's called the Cochrane Collaboration. The Cochrane Collaboration's goal, big objective, is to look at systematic reviews in the space of public health and medicine. Right? Now, that's not what I wanted to tell you. I wanted to tell you the story of this logo. The logo of the Cochrane Collaboration, it might look very random, but this is actually a forest plant. And this is what is called your line of unity. Each line represents a completely different randomized controlled trial. So corticosteroids had not their efficacy to prevent early childbirth deaths of mothers had not been proven for a long time. So basically, if a mother is highly likely to give birth to a premature child, then the likelihood of her death was very high before corticosteroids came along. And this is only in, very recently. What happened is that the doctors basically did, the medical field essentially did 7 different randomized controlled trials. Yeah? And they found that corticosteroids reduced early birth deaths of mothers by 50%. And most of this came from the meta-analysis that got done. And this little diamond here is not as random as you think it is. It's actually the average effect, the meta-effect size of all of these 7 studies. And what it says is that the overall effect size from the pooled data is to the left of the line of unity. That is, the likelihood that the mother will survive is greater than the likelihood of, by taking corticosteroids, is greater than the probability that she will die. Yeah? So it's a positive, it's the odds ratio. And so this little diamond is showing you that odds ratio and saying that on average, you are going to find that corticosteroids are highly efficacious. So that's what I want you to take away, that even today, and the medical profession is constantly innovating and constantly trying to test as to what works and what doesn't, and we are still discovering new things. So if medicine is development, climate change far behind, because just our own traditions in evidence generation are quite poor. The fourth myth in this section that I want to look at is that a lot of things work. Actually, they don't. So people think that, for example, especially for water supply, sanitation, and I can't talk to you about Swachh Bharat, but I won't right now. but water supply, water quality, sanitation, hygiene, all of these interventions, as long as you put interventions out there, people will just pick them up and you'll have, sustained impact, right? What this is again is a forest plot, so you're looking at every study. And what your overall finding is that sanitation behavior, even though people know that it's a good thing for them to do, is not sustained over time. Yeah, and so things like chlorine water treatment, even though people know that yes, their water is not healthy, you could put chlorine into it, etc. After 6 months, you see a steep drop-off. Right? So impacts reduce over time. You can tell people to hand wash all the time, but unless it's a norm amongst their own selves, this is not going to sustain over time. So it's really important to think about the efficacy and the effectiveness of the interventions that we know to be true and to be working, but how they're working 6 months or a year later is very different. So result 1. Innovations in evidence production are helping to explode myths. Okay, the second thing, yes we can, innovations in technology. So what I want to talk about, so GIS, something that all of you are exploring as well. At the GCF, the Green Climate Fund, which is where I'm working, we're using GIS to understand as to how well, for example, the GCF is making investments and how likely is it that we're going to see impacts on the ground. So all of the, we invest in more than 90 countries, in India as well, by the way. And the question is, we don't know the impacts of these projects. Many of them have 10-year timelines, many of them have 15, 20-year timelines. Now, as the evaluation office, I'm not going to wait and tell my board, I'm not going to wait to tell my board 20 years later that, oh, well, yeah, this is not working. My job is to be the early risk flagger, right? And so we have to find out what is the likelihood or the probability that the program will work or not work, and to alert the board very quickly. And so what we do then is to look at, well, what is the likelihood? And there are 2 questions in almost every investment or every program. 1, whether you think that the program is efficacious, just the design of it will work. Right? That's the efficacy problem. That is implementation, don't forget about that. Just the design or the idea, is that going to work or not? That's the efficacy problem. And then once you start to implement it, assuming that the efficacy of it has been proven in a laboratory, does that work or not? And that's the effectiveness problem. And you as the evaluation office have to look at both. Is the design right? And then is it being implemented right or not, right? The efficacy and the effectiveness question. Now, at this point, the best we can do, because the GCF is a very young fund, is to try and understand, is the efficacy there of these programs? So we look at global evidence on one side, and then what is the likelihood that it will work on the ground? Again, many of these are just getting started with the implementation, but what is the likelihood that we can say something about its implementation fidelity and effectiveness, right? And so we then do a lot of this work, the probability of the implementation work. We look at that. Efficacy we look at separately, and I'm happy to talk about that. Using GIS data, thinking about how they are targeting and whether we think it will work given their targeting rules. So this is a big program in Ecuador, which was expected to reduce carbon dioxide by 15 million tons of carbon equivalent, and supposed to reach 450,000 people, right? So these are the project areas, and my team basically got the project polygons very nicely from the project team, etc. But we overlaid it with a whole lot of other GIS layers that we got publicly available, high resolution now. And our GIS lab, we basically overlaid one over the other and found that actually, although this program is looking at land use planning and financial planning in Ecuador to reduce deforestation as well as the degeneration of very important species, many of the targeted areas are highly populated. So if they are already highly populated, you're clearly not targeting very well. And so this is an early risk flag that we can help alert, the board to, for example. And so this is something that could help you as well. Then another example of this is Mexico payments for ecosystem services. So this is work done by Jennifer Ali Garcia as well as her colleagues, who I happen to know as well. and GIS data to examine if it is reducing poverty and deforestation. And I got alerted to it. I was working at the World Bank when they didn't have a GIS lab at that point. And so I was one of the people that helped create a GIS lab at the World Bank, and we had to do a lot of advocacy internally to get the bank to think about why GIS, and this is many, many, many years ago. But it was really important for us to create narratives around why GIS information can help and should help. Right? But just to cut that story short, this program actually showed that the Mexican government was giving money, and is giving money, actually this is a national program, to smallholder farmers to not cut down trees. That's the Payment for Ecosystem Services program. What it showed was not just that the program is helping to reduce deforestation by 2%, depending on they were using the NDVI, so the Normalized Differentiated Vegetation Index. If you don't know what that means, just ignore what I just said. But basically to reduce it by 2%, right? But not just that, it helped to give disaggregated information. So disaggregated information basically to say that larger impacts were seen in communities that are located in low slopes, low altitude areas. So if these were richer communities, then you would know that. Yeah? And also that were closer to cities, but also that wealth gains. So it wasn't leading to increased inequality. Wealth gains were not occurring for any section of society. Yeah? So that was good as well. Okay, then of course in terms of technology, we now have wearable data, rapid data, and some of this comes from work that we are collaborating on. So the World Bank has now got locations of high incidence of malaria. That's DRC, Democratic Republic of Congo, where water is located, where malaria occurs. You can have unintended consequences of a lot of water projects that many projects don't examine, especially if it's stagnant water. We started to look at that. Wearable data, so this is when I was still at 3IE, and we were helping to think about how you could monitor adherence amongst little kids and children. And so this was wearable data, because you also have to think about cultural norms as you start to get mothers to adhere to different regimens of getting their children measured and weighed with greater frequency. And so this was a nice little wearable data piece that they could wear on their neck and still think it's a taviz, which is very nice. But then work that we've done in South Africa, etc., have reduced our data capability time requirements hugely. When I first started at Columbia, and Sekar was giving me this example of how data used to take about 5 years or whatever, especially survey data. We don't have that luxury anymore. People end up looking at Google and trying to figure out, well, what is the truth if you're going to make them wait for 5 years, right? So similarly, there were huge investments being done, and I was working with Jeff Sachs at that point. They had put in a lot of money on surveys, but 3 years later, there was no data still available because everything was being cleaned in a very assiduous way. We started to use tabular data with CS Pro, etc., and it reduced data cleaning using algorithms and skip patterns, so basically from 3 years to 6 months. We could then have clean data and analyze data, and then it's reduced to 3 months. All of this is basically changing the way we are thinking about data, but I'm also reading this wonderful book, if you want, just as an aside, which is called Weapons of Mass Destruction. So, which is basically to say that, look, you have to think about data in a very, very sensible way as well. Because in all data generation, if you're depending on algorithms and black boxes that are underlying them, you have to know what the assumptions are. Yeah. And those assumptions are critical before you start to think about using data. And it's our role as evaluators and as essentially the truth tellers and the speakers of truth to power to essentially think about what those assumptions are before we start to use data. So result 2, innovations in measurement are helping us become smarter.
I have a question. Interesting what you said about questioning assumptions using GIS and bringing out the inconvenient truth. So if you look at the Australian fires, And if you look at people who paid fines for cutting down trees in the vicinity of their households or whatever. So there is a negative correlation, as in these are the houses that are now safe because they did control cutting down of trees but paid huge amounts in fines, because when it comes to deforestation, it is blindly followed that you cut any tree, it's not the right thing to do. So how do you have that difficult conversation wherein you're actually pointing out something that is flawed within the government? So if you're within the system, how do you bring in these corrections by not upsetting the system?
Yeah.
But as a feedback mechanism.
So, if you don't mind, can I just park that question? Because it's a really good question, but I think we need to have a bigger discussion around it. So, difficult questions and how do we deal with it, right? Okay, good. Great question. So, then the third thing I wanted to talk about is delivering the last mile. Innovations in behavior. Now, I can say this because you're all friends, but we know that science is not enough to change anything, including action, including policy, etc. Right? You have to do a lot more. We've got science about obesity, we've got science about drug use, we've got science about alcoholism, we've got science about smoking. Behavior change didn't occur just because you put it out there. How many of you go to the gym every day? Twice a week, 3 times a week, right? But we don't go to the gym every day, etc., etc. Whatever the science might say, it takes very long for us to change our behavior. So clearly, it's not just the science that is important. And recognizing this, then Kahneman and Tversky, Richard Thaler, all of these guys are Nobel Prize winners, basically did and introduced psychology into economics. When I first joined the Green Climate Fund, one of my first examinations was to try and understand, well, what do we know about people adopting climate change behavior? Of course, it's a big, big tragedy of the commons, and most of it is because of the last mile. And I looked at almost all of the economic literature out there, and of course there's very good stuff written, but no one had talked about behavior. I called up the psychology departments because I snowballed essentially all the literature and discovered that most people who were writing about it were from psychology departments. So I ended up having long conversations with professors sitting in psychology departments in the United States and talking to them about behavior, because nobody in economics was thinking about it. But so clearly recognizing that, you have to think about, well, there's and then there's homocysteine. And there is the fast part of your brain and the fast thinking side of your brain and the slow thinking side of your brain. And the big thing is, and even as an evaluation community, you have to start getting people to think of evaluation with the fast thinking part of your brain. It should be sort of just the default. Of course, we've got to do evaluation. It shouldn't be, oh, should we do evaluation or not, and how much will it cost, and what's the evidence of evaluations working. We've got to transition and transform that space. But in decision making, this is clearly important. You've got to think about how to transform a lot of that science that's coming from evaluations into implementation on the ground so that things can be transformative. Okay, so big things that are coming out, and there's a mnemonic that I have. I'm not going to talk about each part of it, but it's called mind space. Essentially, when you're thinking about changing norms or changing, doing nudges or boosts or whatever, you can think about mind space. Each one of the letters stands for something. M is for messenger. Think about who is the messenger. That's going to change how well your message is received. I is for incentives. Are there any incentives, whether monetary or non-monetary, that are going to change the way people behave, even if they have the science? N is for norm. Change the norm. What is well accepted, what is considered good behavior, you've got to change it. D is for default. Yeah? So change the default. What if people didn't do anything? What would end up happening? If you change that, you've got a huge success. S is for salience. I'll give you an example. P is for priming. If you sort of insert the idea in a small rudimentary way, and slowly work with it. It will work at some point, but P is also for persistence. You've got to persist, right? A is for effect. It has to have an effect, and people have to feel like they can bring about the change themselves. Yeah? C is for, I can't remember. E is for ego. C is for commitment, sorry. Yeah. You've got to get people to commit. And E is for ego. There has to be something in there, in everyone's personal egos that you're appealing to. Otherwise, they're not going to change behavior. So, quiz, what's the R?
Intended.
Good. D. D. Very good. Okay. So using this, I'm only going to give you a few examples then, basically, of how this has been used, right? Using evaluative evidence. The first one is, this is Nelson Mandela. You all know this, right? So HIV/AIDS was an anathema in South Africa. People would not even take medicine because if you were HIV/AIDS positive, that stated you didn't want to be known. And because of that, HIV/AIDS rates were going up. Nelson Mandela came to a clinic in South Africa saying, I'm HIV positive. It changed the dialogue. It changed the dialogue because people just realized it was acceptable to be associated with people who had HIV/AIDS. In work that I've done, so we looked at advocacy. Yeah, what works in advocacy and what doesn't. It's a separate paper. I'm happy to share it with you. But my co-authors and I looked at, essentially, there are very cool things also about what is the nature of the messenger that people are far more likely to listen to. Yeah? If the messenger is someone that you can associate with, that you have some common background with, if the messenger is someone that you think should be respected for reasons, say, education, etc., you end up listening or talking to the messenger. There's some not kind messages as well. Skin color, age, race, sex, all of those things matter. So you've got to, but the thing is that you have to be aware of these things that are part of your fast-thinking brain if you want to mitigate that. Right? So these are things that we basically found in our advocacy work. Second is change the default. Right? So this is ACT, artemisinin combination therapy that used to be used for malaria. It was 8 tablets, created a whole lot of side effects, but adherence rates were very, very low. Because taking 8 tablets for basically 8 times a day, you're going to lose track. And then the first time you lose track, the second time you lose track, the third time you're like, forget it, I'm not going to do it. It's not going to help because I've been failing. Researchers realized this, changed the default, combined it into 2 tablets. Take 1 in the morning, 1 in the evening, you're done. Yeah? Malaria incidents have gone down as a consequence. Another example of default. This is basically in a lot of deprived situations, a lot of mothers would come in with their children, so malnourished. And malnourishment can slowly become severe acute malnourishment, right? Moderate acute malnourishment can change to severe acute, man to son. But they would come in and they'd come to get cured, but they would bring the entire gaggle of children along. Those children would stay in hospitals for long periods of time, even if they're getting cured or even if they're getting treated for MAM, but then they would get infected because of everything else, and then it would essentially become even more dire. Ready-to-use therapeutic foods have changed this. Ready-to-use therapeutic foods combine not just protein and carbohydrates for energy, but have taken in micronutrients, and mothers can basically administer this even in their households. And it does not have to be combined with water. Water is also the transmitter of big disease. Right? So you can sit there and you change the default. You can sit at home and deal with MAM, moderate acute malnutrition, and not let entire populations slide into severe acute malnourishment. Okay, change the norm. This was the N in my mind space, right? So this was work that has been done by the behavioral lab, so the Behavioral Insights Unit. And by the way, we have a behavioral and design lab in my office as well now. And we're doing now work to try and understand, well, what can help us go the last mile? But essentially, if you change the norm, my bill in Korea, my electricity bill, has a comparison with the average in the building. How much electricity am I consuming compared to the average in the building? Helps you set the norm. Yeah? If I'm consuming too much, it then basically in econometric language, it is controlling for wealth, family size, unit size, etc. Right? Just give me the comparison. If you change the norm, you're going to change your behavior.
Just one moment. I think it can lead to an unintended
Yes. Good. Thanks. Let's talk about that. You want to talk about the unintended?
Yeah, basically that, let's say, it can be taken as a barometer for a wealth and saying that, oh, he uses more electricity than me, that means he is more, or that basically my neighbor is, I don't know, more outgoing or more wealthy, more wealthy than me. And then maybe in order to showcase that, I might just start using the electricity more. I just, one of the consequences that, usage is associated with that.
So, good point, and I thought you were going to say, so remember it's the average. I don't get to know who my neighbors are, right? So it's the average in the building or average in my neighborhood. But that's important. So it's not that, but it is true that if I'm using less energy compared to my neighbors, then I'm going to mean revert, right? I'm going to revert to the mean. And you don't want that to happen because you want to keep everything low. So mean reversion does occur, and that's the unintended consequence. But not so much sort of saying, oh, well, the neighbor's better off, because you don't know who which neighbor is consuming. It's just the average of the neighborhood. Okay, then salience is essentially thinking about things like, well, if you put, apples and fruits rather than candy and mithai right next to the cash register, you're more likely to pick that up. So make it more salient. And then the second last example in this space is using checklists. And I can't speak about this enough, right? Atul Gawande essentially broke open this idea of using checklists, but it has, forget innovations in rapid data and, technology, etc. The most basic thing that has changed implementation fidelity has been the introduction of checklists. Checklists basically is because you can take away a lot of the errors just by introducing this. And along with that, your choice architecture is changing. And this is the key thing that Taylor and Tversky, etc. said. Change the choice architecture. And then you're basically going to just have greater fidelity in your program. With checklists, you're essentially introduced a small, non-technology rich innovation into a process, which has then cut down. And airlines use it all the time, and now doctors do. And my last example here is reminding the brain. So I think a couple of you who were at EvalFest probably saw this example, but if you haven't, I'm just going to go through it. In the 1990s, basically in the US, there was work that discovered that doctors didn't wash their hands before going into surgery rooms. And that led to about 10,000 deaths over a 10-year period. That's a huge amount of deaths. And doctors should know better. They know germ theory better than most of us do, right? So they know how transmission occurs. And then they did a lot of work. They tried to understand, well, why don't they? And they don't have time, and they take off their glove, but they take out the other glove, and their hand is infected, etc., etc. So doctors should know better. So again, science is not enough. But they weren't. So what did doctors at Imperial College and London School of Hygiene and Tropical Medicine do? They said, okay, let's examine what can help. They installed hand sanitizers at the entrance of surgery rooms. Okay, so hand sanitizers did help, but it changed hand sanitizing behavior by a measly 15%. If you're losing thousands of people, 15% is not a big change. Okay? So they then said, okay, let's do something else. Let's make them feel like they are being watched. So they put pictures of men's eyes on top of these sanitizers. They also put pictures of women's eyes in front of these sanitizers. So you're being watched. The third thing they did was to use something from behavioral science, fast-thinking brain, was to spray lemon scent in front of these surgery rooms. Yeah, so just before you enter, lemon scent sort of gets sprayed. What were the results? So in your control, where you just have your sanitizer, it increased by 15 percentage points, your hand washing behavior, your hand sanitizing behavior. Female eyes, basically 22%. So over your control, it's a 7 percentage point increase, right? But with men's eyes, it's 33%. So over your control group, it's an 18 percentage point increase, right? 33 minus 15. Clearly not, women's eyes are not as effective as men's eyes are. But the olfactory effect, the effect of spraying lemon scent, basically changed hand sanitizing behavior to 47%. So over your control, that's a 32 percentage point change. And that's because it triggers something in your brain. The lemon scent is making your fast-thinking brain think, oh God, I've got to sanitize. Yeah? Now, of course, restaurants in Europe, etc., have used some of this. Waiters will go and spray lemon scent so that the people who leave their tables automatically clean their tables and they leave. So the waiters have to do lesser work. So things like that. Yeah? You can introduce these nudges and boosts, etc., to get people to think much more about what they should be doing. So result 3. Innovations in understanding behavior is helping us deliver the last mile better. You can design innovations, you can think about knowledge, you can think about interventions, implementation, etc., but you've got to think about that last mile. What is going to make people change their behavior? And this is different from behavior change communication. It very often gets confounded there. BCC is not the same thing as behavioral science. Behavioral science is about the nudging and the boosting and extolling and looking at your fast-thinking brain and changing behavior so that your fast-thinking brain thinks this is the right thing for us to do. Yeah? So how are we changing? So how are we reacting to this, etc.? So think of my problem. When I came 3 years ago at the Green Climate Fund, I was the first head of independent evaluation. I report directly to the board. And that was basically me. I just had one office, and that's me. And then I had to think about, well, there is, this fund which spends approximately about $3 billion every year. And clearly, the board is going to ask me very soon, well, is it working or not? And I should have some credible answers, right? So I realized very quickly that we had to set up measurement systems. I'm a data person. I'm a data geek. I love that part of my work, but I also have to think about, advocating and working very closely with the board, and I suspect that's what you all have to do a lot as well. Hopefully you have to think about evidence, but you also have to think about, well, how's the Prime Minister's office going to look at this, right? And think about changing action, strategy, policy as a consequence. So the first thing we set up is learning-oriented real-time impact work. And this will essentially marry 2 big things that I was really interested in doing. One, ensuring that every investment that the GCF was making, and investments of the GCF range from $10 million to $200 million. Yeah? Every investment that they were making, we were at least gearing them up to understand what the outcomes are going to be and what the impacts are going to be. So it's not just about output and activity. And this is what most organizations think they should be doing, but we have to think about, well, what's the outcome and impact? One was that, so that is the impact part. But I also knew that we had to work very closely with projects on the ground, and they have to be incentivized to put in money, resources, efforts, and energy into something like this. If you tell them, well, we're only interested in measuring impact, they'll tell us, well, come 10 years later, we don't care about you right now. So it had to be incentive, there had to be incentive for them to change behavior and learn continuously and course correct. So we introduced learning-oriented real-time. So all of the data that we generate, basically, is part of the real-time data sharing work that we do with each one of the projects. So we wanted to measure change caused by and attributable to a GCF investment. That was my goal, now my team's goal. My team is now 30 people just sitting in Seoul, but we also have teams across the world. Build good baseline data and continuous data collection. So we wanted to know where you're starting from, but also know in real time how you're changing. Think about designs to produce good evidence and measure impact. And here we introduced the idea of doing experimental, quasi-experimental work. So a large part of our thinking was to get them to think about co-authoring, co-owning, co-designing, co-implementing with us exactly this kind of impact measurement. So it's not like I'm coming in or my team's coming in and saying, oh, we're here to police you. No. They get to design the impact evaluation, the RCT, with us, and they get to co-author co-design it, co-implement it. That's important. We also then provide real-time feedback to program managers and co-design, like I said, measurement systems, creation of counterfactuals, and identification methods. This is now extended to basically approximately $1.5 billion of our projects now have impact evaluations built into them, as well as measurement systems that are real-time. Right? And then we are hoping that this will become board policy as well. The second very quick example I'm going to give is...
We have a question.
Yeah. I'm so sorry.
Just trying to understand, like, how do you also, is there any mechanism through which you also evaluate your own evidence used amongst the program? Like, for example, you mentioned that co-design is a mechanism of ensuring it, but how is it being actually used, and what has been the effectiveness, so to say, or enhanced efficiency because of the use of this evidence?
Yeah.
Is there an internal mechanism for that as well? Because that will enable us to check, understand our own process.
Yeah, whether we are doing it well or not. You're absolutely right. So we are the independent office, right? So part of our challenge is also that we are independent, but we don't want to course correct the projects too much. So we put it out there. But part of it is really knowing whether we are making a difference while being independent. So we are setting up systems to understand how projects are doing this. For us, currently, very, very basic outcome indicators are indicators or lead indicators. If the projects are interested in committing to uses of water, and it's completely country-owned, so we don't come in and say, you've got to do it. If they demand, then that's a pretty good indicator of things changing. If they continue to do it 2 years later and are part of the co-owning, co-implementing, co-designing team, then that's a lead indicator. But you're right, we also are reporting to the board, because finally, that's my Lord and Master. So I have to basically go and tell them how well their investments are working. But we also get evaluated externally. So my office, who will evaluate the evaluators is the big question. So, and we're very cognizant of that. So we also have an external agency that comes and evaluates us. But these are the lead indicators that we are using. Sikha, with your permission, actually, I'm going to skip this because I'd rather that we do the discussion with all of you. But if you're interested in talking and thinking about impact bonds and how we are pulling in impact evaluations and measurement and verification systems, I'm very happy to discuss it. I love this example because it's about rhino bonds. But if you're not working in the private sector, then perhaps this doesn't apply. But I'm happy to chat about it if during discussion, again, if it's demand driven. Otherwise, going straight to conclusions. First, innovations in evidence production is helping us explode myths. We don't know everything that we think we do. Many things that we think are working are actually not. So we need to collect systematic evidence, and we need to think about meta-analysis. So the 4 examples were first about the systematic review and the systematic review in humanitarian situations about cash, in-kind, and food transfers. The second was the graduation approach and looking at what works in poverty. The third was to understand that you could use, what was the third example? Anyone? That hand sanitation, things like that we think, yes? Things that we think are working may not be working, and we only get to know once we start to collect evidence, right? And the fourth example was Cochrane, that you think we've got evidence about everything, but we don't. We are constantly innovating even now. That was the first. The second is innovations in technology are helping us to measure better. This is GIS data, wearable data. I'm a big fan of GIS, especially now as high resolution data become very cheap, etc., that you can use. Definitely encourage it. Understanding behavior is helping deliver the last mile, but we've got to think about mind space. For every intervention, think about how that last mile is basically going to be met. And evaluation practice is changing. Thank you. Because should I come and sit there?
Yeah, please come in. So the floor is now open for questions.
I have a small question on the example you have taken for hygiene practice and sanitation in oil. So, I mean, apart from the studies that you have undertaken or you are quoting here, is it also essentially because of the base effect that earlier we were having more benefits of hand washing and sanitation, and later on gradually as we are moving on, earlier there was a benefit of say 60%, then reducing to 50% and then reducing to 40%? Or after a certain point of time, if we compare two groups which so far were maintaining the same hygiene and sanitation kind of thing, but later on one of the groups stopped, after a particular point, and other group continued, and still we find that the effect on the continued group is not continuing the way it should have been continued.
Okay. Should I take questions as they come, or?
Yeah, maybe I think people are still assimilating what you said. Yeah.
Okay, so let me try and answer that question on where's the effect coming from. So if you look at the forest plot that I put together, basically, which is actually taken from a systematic review, they looked at effects 6 months later and 12 months later. Mm-hmm. And this is, so the effect size by definition is essentially over and above your control group, right? So you have control or what I call comparison groups. So that means they have either not had the infrastructural intervention, which may be related to, or the process intervention or the behavior intervention. So this may be related to put chlorine in your water, or go and hand wash, or carry water from a safe water dispenser like a hand pump compared to a well which has stagnant water, etc. So it may be awareness, it may be the presence of infrastructure, etc. But the idea is that it's over your control group. People who are not doing it, right? So it's what the evidence is showing is that compared to behavior 6 months, 12 months there's an attrition. There's a funnel of attrition essentially. So people do react, and there's also the novelty effect, and this is a pretty well recognized bias on the behavioral science side. There's the novelty effect. You introduce a new innovation, people start to get excited about it, etc., and then it sort of drops down, right, and reaches some equilibrium effect. And so in innovation and adoption, you have what is called the S curve. It takes a very long time for people to adopt, and then you have the inflection. People, react to it, etc., and then it plateaus off again. But the idea is that even at that plateau, it starts to drop off. And so you see that attrition if you look at the time aspect, irrespective. And this has been seen for cook stoves, for example, as well. So it's not just true for hand washing innovation, which is related to infrastructure and or process changes, but also for cook stoves. You can give efficient cook stoves. Entire evaluations have basically just discovered that people don't even use. 6 months later, the attrition is 2/3, and then after that, people stop using efficient cook stoves. So it's the difference between the efficacy and the effectiveness. Effectiveness on the ground just is not there. It might work very well as a design, but it's not. It's the effectiveness because people don't keep up with that behavior.
Can you link changing behavior as you explained to this particular answer, like as a solution going forward? It's not just about influencing people, and all of this is usually done through behavioral change communication. Then it doesn't last, but then changing behavior might actually change the norm of what it does. So how do you see solutions on that front?
Yeah, really good question, because this is actually the frontier work that's being done in behavioral science. One of the things is that behavioral science, you can see that a lot of that work has been seen to be successful when you have one-off changes. One-off changes, so if you change the default, whether you want to be an organ donor or not, or whether your pension should go into 401ks or, into pension say, pension accounts or not, you change the default. So if you don't tick off a box, basically it'll go. That's a one-off. If you change the default, you don't need to keep coming back and revisiting it. So behavioral science works quite well with that. But if you read a lot of the work that Tversky, Taylor, etc. have done, then what is also emerging is that if you want to consistently keep that behavior, yeah, behavioral science, the efficacy of behavioral science approaches might be a little bit lesser. So you have to then think about what are the other things that might be working, and that's why sort of the mind space, right? And think about incentives. Peer groups, they work fabulously well. One of the first things that I refer to when organizations ask me about, well, how can we change productivity, is people think that all you require are financial incentives. Actually, financial incentives are not half as salient as social incentives. And so you've all probably seen studies around it, but non-monetary incentives as well as social recognition is far more salient, far more powerful than what you could do elsewhere. So I don't have a clear, clean answer or a soundbite response to essentially your question, but I think you have to examine this each time. What might work, what's a one-off versus what is a continuous intervention that you require.
Can I ask
Shiva?
a follow-up question on that?
Okay. Then later, Shivam. Yeah, go ahead.
So when you said examine what to do further, can I link it to your examples of placing men's eyes and women's eyes over it? Are we? My question is: are we missing certain interlinkages in our studies itself as a design? For example, you place men's eyes and women's eyes, and you found a number of one of them is more effective, but that doesn't take into account the gender ratio in the doctors, which might cause interlinked influence. So that way, how do we as evaluators realize there are certain, important interlinkages that exist, but we might be missing, but how do we go back and find those? If something is not working, how do I systematically go back and find these interlinkages? Are there like certain pointers that can help us do our work better?
Yeah, it's a really good question.
Actually, that is one of the recent researches that is happening, is that how the research results that come out do not take the gender bias into account.
You can run a regression, control gender and see the.
But then,
but are we missing these somewhere? Because we talk about gender as a cross-cutting
So that's
but
why
building it into the
generally you try to randomize so that you hope that all the other factors are taken care by randomization.
But in real-life situations, there are certain.
But here definitely I think it's possible, gender.
You could control for it, but also I think as evaluators, we just have to be aware of our own biases, right? And that's where I start off from. What's my bias? Now you refer to someone as a doctor and I automatically think, oh, he must be doing very well. Why am I only thinking he, not she, right? So you have to think about your own biases as well. And I'm not sure actually that would be true if you just had women doctors. I don't think that women would actually respond differently to sanitizers here compared to men.
I'm just using that example.
Yeah, no, I think it's a good one, but I think you have to recognize that we all have biases. We're all human as well.
So there's one difficult question you.
Yeah. How do we discuss? How do we take? Can you say your question again, just so that we can frame it better?
My question was, when you're within the system and you're trying to do evaluations, but that ends up showing you in the bad light, me as a implementing body. I did something with very good intent, but there was an unintended consequence, and if it goes back and questions my entire implementation, then I would rather not get into it, or I would not, if I can influence someone into not getting into it, because I'll be questioned in a political economy. Absolutely. That happens most often.
You are as unpopular in GCF as evaluation people in ADV are? Okay.
In fact, I was at ADV a week and a half ago.
Yeah. Okay.
So I was there for 3 days, which is wonderful.
So generally we, from operations people, we don't sit in the same dining table as the evaluation people. I'm just joking.
Yeah. There's only one thing that if I'd had the time, or maybe the next time I'm here, we can talk about some of this. So we've devised some strategies to help us with that. Because, and you're only talking about, you're an established department and, you have the backing of pretty important parts of government, etc. When I first joined GCF, and so this is a little bit of a... Sorry, you don't? Hopefully you do, and it will come there. But if not, then here's a story. When I first came, actually, hopefully it'll make you feel better, because mine was actually even worse. They hired me, and at my interview I said, well, what's my budget going to be? And the board said, oh, don't worry, whatever you want. But of course, once I joined, I said, what do you mean budget? And what do you mean staff? Why do you need anything? We're too young right now to even get this. And of course, the GCF, because climate is such a political issue, is, everybody was like, you'll just tell us what's going wrong, and nobody will give us money to distribute. And that's a pretty big concern and a risk that the board had with the evaluation function, that you'll just make us look bad, and then no one will give us money to essentially, and we'll go out of business. And I got told that by board members. So you have to then start from there and say, okay, first, you become a pariah in the international community. So this is, if you don't start to talk in a transparent way about what's working and what's not. Second, why don't you say that you want to learn? This is really important. Who owns the evaluation results is really important. So what I basically told the board is, you get to say what are the evaluations, and you get to, use the messages for directing the secretariat according to what you want. You have to see us on your side. But this is probably not the forum, but I can give you ugly stories about how I've been sort of personally and professionally, had to deal with a lot of the challenges, because everybody will say everything nasty. But you've got to get people to own the results that you're bringing. So if you say, well, you get to own it, you get to say as to, what's working or not. When I was at 3IE, a lot of governments didn't want to do impact evaluations because it would just make them look bad. So we let governments know that as long as they were okay to go, that they should go out and say, we have commissioned an impact evaluation. We want to learn what we can do better. It makes you look good. We're such a, forward-thinking, learning part of the institution. So owning that is really important. And it's the last part of that mind space thing, right? Ego. You've got to think about that. And this is really important, because the evaluators will not work if all you do is come and give messages. You've got to think about your own last mile.
Shivangi?
Yes. My name is Shivangi, and that was an amazing presentation. Thank you. My question is around behavioral science. So I'll present a situation. So let's say that I'm trying to increase the health-seeking behavior for people who are suffering, like in the space of mental health, and I'm trying to create behavioral nudges so that they can approach help in case of serious mental health issues. Now, what I want to understand is that if 10 years before I was trying to do a similar thing, how would the behavioral nudge differ in each of these two cases? That is one. And the second,
what are the two cases, sorry?
Well, like 10 years before, when the mental health awareness was not as much as it is right now. So the idea is that, what I'm driving towards, is there a limitation to when and which kind of situations I can use behavioral nudges? Because the examples that are usually presented in a lot of literature are hand washing, are basically around areas which are already well known. Like, you know that you have to do them, but still, you don't because of, as we can discuss. That's my question number one. And now secondly, I think I was one of the interested people who wanted to know about development impact bonds, because we don't talk about financing much. We don't realize that we, in order to meet, let's say, our SDG targets, the government fund is not enough, or even in India, the philanthropy fund is not enough. So we will need an alternative financing model. So if you can just maybe discuss one case,
sure,
that would be super helpful. Thank you.
Should I? Yeah. Okay, so just on the, sorry, could you actually put my presentation back? I'll just do it very, very quickly. Because I think it's might be an interesting example. We started to get GCF interested and excited about this as well, because impact bonds have not been used as much as I would like. Okay, so impact bonds and helping runners. And, I said rhinos because they appeal to me, but it's also sort of a nice thing to think about. But of course, impact bonds are very serious things. So the example here, and okay, I have to say 2 caveats. This acronym is not mine. It is the first book that got written on this, etc. They introduced the idea of mind space. So first is that, and second, this picture is also not mine. It's actually taken from FT, from the Financial Times. It was so nice when I was reading it, and because this is the only thing I was thinking about at that time, so I used it to illustrate what I'm doing. Okay, so the idea is that South Africa and Kenya were thinking about increasing the rhino population, and this, by the way, has been used also for learning bonds in India. So in Rajasthan, you know.
The education.
Exactly. So the idea is that you have a you want to improve a social or a welfare outcome, and this has been used in Australia, the UK, recidivism, etc. But it's not been working for a while, and you also want to pull in private investors who are interested, because they are, you know, forward-thinking citizens of the world, etc., but they just don't know how to come forward or to help with such, right? So there are different actors here. The first, Okay, so the first are investors. They are willing to commit money to finance a
From there are few key messages or ideas that have come through, especially on LORTA. Right now, I think we are engaging with the ministries towards the end. I probably we should start thinking about engaging with ministries as partners, even during implementation. I think we do some of the rapid evaluations, which is like process evaluation. But maybe it's based on ad hoc requests from here and there, but maybe we can actually reach out and ask them if we can be partner in supporting them. Probably that also will help us in reducing the tension between an evaluator and those getting evaluated. Yesterday I was in this session at EvalFest, and I read through the material. I realized they give big words, but I think intuitively we are actually doing them. They call it a transformational evaluation. The reality is working with your people who are getting evaluated in a collaborative manner, not passing judgments, working with them closely, understanding them, and getting their inputs also into the evaluation process. I think builds trust, builds ownership, and also probably builds credibility of the report and greater acceptability. One way for us, we are doing this CSS evaluation, is to just do it and then give the final report to them. It will be shocking. It would have explosive environment. The other is to go have this inception report. It is delaying the process, midterm report, but also respecting their feedback, trying to incorporate them, because ultimately they also have a huge amount of wisdom, and there's a reason why they are failing. And they are failing because there are lots of constraints in which they are, binding constraints in which they are operating. If you don't want to understand them and say that you have failed, I think that will end the process. So, because there was this whole question about, like we are evaluator and how are we going to talk about the difficult questions. I think if we are engaged right from the beginning and also engage them as a part of the whole process, I think it's not only about why it has failed, but if we can also give also highlight why it has failed and differentiate the ownership. Like sometimes where you need 100 people to implement a project, you are asking 2 people to implement. Everyone knows it, but a third-party validation of the fact, it says it also probably helps those 2 people to differentiate themselves from the failure, because it's a failure of the system, not of the 2 people sitting there. So my sense is, I think, at least from this presentation, maybe we should, we are establishing partnerships with 3IE, JPAL. Maybe we should go out, talk to the ministries and ask them whether they would be interested to do some experimental studies. as a part of a larger program and bring this expertise and do it. So my sense is that there's need for more engagement, if not everywhere, but at least, you know, out of the 67 ministries, I'm 100% sure that we can find 5 to 10 ministries with champions who want to do better work. So that is something that has come to my mind. I want to conclude with one book I really read on behavior change, and it stuck to me long back. I read it. It's The Power of Habit, Charles Duhigg. I think the one example he states in his book is that for habit to be permanent, as Joe mentioned, you know, if it's a default thing, it's easy. Okay, pension contribution, you can. If the default is 30%, probably people will not see and they'll just sign on it. If it is 0, so that is easier. For a permanent habit to be formed, I think he talks about 3 things. You know, you need to have a trigger which reminds you about the habit. Then there should be a routine, and then it should lead to some reward at the end. So they talk about morning toothbrushing. You know. So across the world, it is one habit that everyone follows, no? All human beings, generally. So they say that initially when they introduced it, no one really did it, but one small tweak helped it. The trigger is, okay, morning you get up, so you have to do it. I mean, exercise also you can have it, but let's figure out. Then the second routine is, okay, you brush. But originally there was no incentive or reward at the end. And these Colgate guys and others, these are extremely smart guys. They found an incentive. They put menthol into the toothpaste. So you have this sense of freshness. It has no scientific basis. It only gives you a sense that after brush, your whole mouth is. Earlier it was with normal chemicals, it was okay. So anyway, I just thought it was an interesting thing. And so let us figure out, there's a gym here, every day evening after work you have to go, that is the trigger. Then routine is you have to go and jump, run, it's the incentive. What's it? Maybe we can have a award for with clear outcome indicators.
Niti has already thought about it.
One was for recognition.
Yes.
Gold star at the end of the
They have
month.
a boot camp now.
Yeah.
So,
Yeah, I think we can have a geo tag using all this geo-coded information. Anyone who spends like half an hour inside that space, we can have multiple indicators. Anyway, thank you all, and let's give a applause. Maybe if you have any further questions, you can have it offline now. And after that, we can have a short.
Yeah, I'll come back.
Thanks a lot.
Thank you so much.